Hi, my name is Steve Welty. I'm the Division Chief of Neonatology at Texas Children's Hospital. A huge problem, both nationally and internationally, is maternal and infant health, to the extent that 800 women die every day of complications in and around the delivery of their baby, and about 17,000 pediatric patients under 5 die daily, with about half of them that die in the neonatal period. This is very important for us to address. It's both a problem in the developing and the developed world. But sub-Saharan Africa is making attempts to improve women and infant health by increasing the facilities, increasing the number of people in the process, and really expanding the human resources aspect of improving maternal and infant health. The problem is it hasn't had much of an effect on mortality and morbidity in both the women and infants, probably because there are still issues that have to be addressed, such as quality improvement, working on processes, and good collaborative learning in complex systems that healthcare systems like that are. The Global Initiative for Better Health is a nonprofit organization committed to improving the healthcare of moms and babies, and really committed to doing it from the perspective of working in quality improvement, working on processes, working on complex systems, and how we can do processes better in those types of systems. And what the initiative that we're looking at now is working with Gandhi Memorial Hospital in Addis Ababa to improve healthcare in that specific area with good collaborative learning, with good process and environment, bringing people together and talking about how we can improve the systems and the areas in which we practice care. I hope that you would, in this upcoming video, that you'll see some of the excitement, the level of commitment, and some of the possibilities in the ways we can improve outcomes in mothers and babies, and work with us to make our babies better.
Addis Yeshiwas, a 25-year-old housewife, is in the labor ward of the Gandhi Memorial Hospital in Addis Ababa, Ethiopia, where she and her newborn will be given all the best possible care and treatment. Addis and many pregnant women attend the hospital for prenatal, delivery, and postnatal care, as well as gynecological incidences. Gandhi Memorial Hospital was founded in 1951 and became operational in 1954. The hospital was established to provide care for mothers and newborns, as well as treat gynecological problems. The hospital began giving service equipped with only 25 beds, 7 nurses, and 1 medical doctor.
It is only a main government maternity hospital in Ethiopia. This coming November, the Gandhi Memorial Hospital will commemorate its 60 years of service. And within these 6 decades, over 300,000 assisted deliveries were done at the hospital.
This data shows that 600,000 mothers and newborns have benefited from the services of the hospital. And in a country where mother and newborn mortality is one of the major healthcare challenges, the contribution of the Gandhi Memorial Hospital towards the reduction of maternal and infant mortality is significant. Through time, the hospital has expanded its facilities and services. A new wing was added to its facilities through donations by a private citizen, Wezero Mintawab. This greatly increased the hospital's admission capacity to 100 beds. Alongside this expansion, other services such as reproductive health care, family planning, and inoculation were added. HIV/AIDS services and counseling began to be provided also after the pandemic broke out.
In 2008, neonatal intensive care unit was established at our hospital to care for preterm born babies and newborns with complications such as breathing difficulty. Later in 2012, the Women and Child Integrated Justice and Care Center was found to assist victims of rape and gender-based violence. This center is unique in that it offers integrated healthcare, law enforcement, and judicial service. Thus, victims will be given medical, police, and legal as well as pharmacy service at one stop.
This is the regular outpatient section. Here, expecting mothers come for prenatal care and infants are received for inoculation and other treatments.
When expectant mothers come here, they are screened for BP. Then they come to me. My first inquiry is about the term of the fetus, followed by asking the nature of the complaint. There are those who come for periodic checkup and others because of problems. Our primary responsibility is to detect risk. That is to identify beforehand expecting mothers who need inpatient admittance at the end of their term and those who require ultrasound checkup. Here at regular OPD, 3 doctors are on duty during morning hours. In each morning, I examine 20 to 30 patients. The flow is less in the afternoon, dropping to 15 to 20 patients. In general, each of us doctors examine 60 to 80 patients daily. I'm married, and this is my first pregnancy. I used to do my follow-up at another hospital, but once I came here, the difference in service won me over. The hospital is devoted to mother and child care, so I feel reassured and secure. I am in my 7th month. The health of both the fetus and myself is in good condition.
The hospital's emergency room receives urgent cases such as mothers who have broken water, suffer from bleeding, and other conditions that seek immediate attention. The working space is cramped, the setup old and worn out, the same as much of the items in the hospital. Here, the medical staff assesses the condition of the patients and directs them either to the delivery ward, the surgical section, or the regular outpatient department, according to each case.
I came today because I noted fluid emission and became anxious about the safety of the fetus. The doctor has ordered me an ultrasound checkup. The doctors are very helpful and the medical staff really caring. From the beginning of my term, I come here for regular checkup. The care I'm given is incomparable. At triage section, we determine priorities by categorizing patients. If there is bleeding or increased blood pressure, such cases are assisted first. If the condition of the patient is stable, we give assistance accordingly. A couple have been trained on triage, the rest of us do our job with know-how we gain through experience. We very much need training because patients could come to harm through error in categorizing.
The hospital offers laboratory services, but due to the lack of equipment, the services it provides fall short of the needs of the patients.
At national level, it is the only government maternal hospital and many major hospitals refer maternity cases to this hospital. The referral includes laboratory tests. As a result, about 200 sample tests are done at this laboratory daily. We do complete blood counts, chemistry or organ function tests and parasitological tests as well as tests for rape victims. However, Many critical tests such as electrolyte and hormone analysis are sent abroad to other laboratories. This is because we lack the equipment.
The autoclave corner in the hospital is entrusted with sterilizing pieces of equipment and appliances required for the hospital's treatment procedures. This section fares no better than the lab. Most of the sterilizing machines are not functional, stressing out the active machine and the section's workers. Moreover, if a breakdown occurs, there is no backup, a situation that will be hazardous to patients and an obstacle to the medical staff.
Of the 4 sterilizing machines, this is the only one currently functioning, so the workload is heavy on both machine and workers.
The hospital's laundry room, where all the linens are washed and ironed, provides its services almost wholly manually, and the bed sheets and aprons are sent for use without being ironed. Yet, the hospital strives untiringly to meet the needs of the people and today provides prenatal care for up to 120 women, and the delivery room admits about 35 mothers daily on the average.
The delivery ward lacks critical equipment, such as ultrasound, Doppler, and CTG. We are therefore obliged to outsource the service every time the need arises. Also, the beds are not of the type that converts to a breathing couch, so mothers have to be hauled to the delivery room. An agonizing situation to the patients and which poses the risk of birth during the transport.
Finally, the time for Abainesh's delivery has come, and she gave birth to a baby girl through interventional delivery using instruments. But other mothers may require operational vaginal births or cesarean delivery. From the total women delivered at the hospital, about 35% require surgical procedures, as could also gynecological problems. Abainesh has given birth according to term, and the baby is healthy. But 120 to 150 newborns each month are admitted to the neonatal intensive care unit. Previously, newborns with complications or preterm births were sent to Tikor Ambessa Hospital. But since the NICU was established 7 years ago, the hospital provides the service.
We provide service to infants up to 28 days since birth who suffer from complications such as suffocation, breathing problems, swallowing amniotic fluid, and prenatal birth. The latter we keep in incubators, which serves as surrogate womb. We have in our care now 5 preterm births and 10 infants with various complications. Their mothers come to breastfeed them. Nurses, a doctor, and a health officer are in attendance 24 hours a day. We require equipment such as X-ray machine and a machine to diagnose infants with heart complications.
Our laboratory requires chemistry machine, hemoanalyzer, electrolyte analyzer, and blood gas analysis analyzer machine. The operating room badly needs operating tables, ventilator monitor, and the anesthesia machine is not up to standard. The delivery room lacks ultrasound, CTG machine, and external topo dynamometer. We lack a phototherapy machine to assist preterm births.
No less important for optimizing the hospital's function and quality service provision is the training of its staff.
We need training to improve the quality of our service and expand access to the hospital. Therefore, the hospital requires training to fully contribute towards the well-being of mothers and children. It is not only enough to acquire the modern equipments, but the staff needs to be trained in how to use them effectively. After delivery, mothers are admitted to this ward, and here we monitor them for presence of vaginal fluid, and their vital signs are taken. Then the ward nurses instruct them on how to breastfeed and handle the newborn. In addition, family planning benefits and methods are explained to them. Contraceptives are then issued to the mothers 45 days later.
I gave birth to a baby girl. I wanted to be delivered naturally, but my breathing began to fail, so I was delivered with the help of instruments. I'm in good health now. I cannot say enough about the care and assistance I was given by the hospital staff. I never imagined such a reception and treatment. I am delighted.
We have undertaken to set up maternal and infant intensive care units. We have prepared the space. Our need now is for equipments and training. The ICU requires 5 monitors, oxygen cylinder rotator and beds.
Abinesh is now ready to be discharged and go home. Surrounded by family members and a baby girl in her arms, Abinesh is filled with joy and gratefulness, thanks to the care and assistance of the Gandhi Hospital facility and staff.
As the Gandhi Hospital medical director and professional, I call upon all those who view this video to support us in equipments and training, so that we are able to assist mothers and newborns even more and even better. Therefore, it's my firm belief that all stakeholders, civic societies and donors will heed our call and come to our support.
Gandhi ለመርዳት እጆቻችሁን እንደምትዘረጉልን ተስፋ አደርጋለሁ። አመሰግናለሁ. Thank you.